use what we call the pulse oximeter. Okay. So someone in mild, the normal oxygen rates in a person should be around 94 to 100%. But someone with in the mild category, maybe oxygen will be more than 95%. And then someone in the severe, it will be less than 92%. So, okay. And then you realize that the person is breathing very fast as well. In the severe,
that's mild.
In the severe, very, very fast, extremely more than about 180, but in the mild, it's just the person can go about a bit of activities. In the mild, the person talks in sentences. The person is able to talk. But in the severe, you realize that the person is finding it difficult to talk. So the person talks in words one by one. Why? Because the person is finding it difficult to
his or her breath.
Yes.
Oh, exactly. That must be terrible.
And then in the mild, the person doesn't look confused or drowsy or agitated. But in the severe, the person happens to look very confused, drowsy, and agitated because of its severity. Yeah.
Okay, so let's spend a couple minutes on this types, the mild and the severe, so that people listening to this interview can identify a friend or a family member who has mild or has severe. Do in both conditions, do the patients wheeze? Did they make a wheezing sound?
Yes, in
both conditions.
In the mild, there's a possibility of the wheezing sound to be there, and then in the severe too, the wheezing is actually very loud. In the severe patients, you can hear it.
Can you make the wheezing sound for people to hear? Just how does it sound like?
That is going to be different.
It sounds like a whistle.
Yeah.
What's that?
Yeah, something like that.
Oh my God, that's terrible. So in both types of asthma, you can have the wheezing sound.
Yeah, the wheezing sound.
And then you repeat again. You said the mild. The person speaks in sentences.
Yes. The person talks like the way you're talking. He's able to talk in sentences.
Catch his breath and talk normally. But if it's severe,
maybe
I'd say one word.
Help me. Something like that.
Wow.
Yeah.
That's interesting. It's curable, is it?
No. Asthma is not curable. There hasn't been any cure found for asthma. Yes. So it's only manageable. It's a long-term condition that is manageable, except for the divine intervention of God, of course. Then it's not curable.
Okay. Let me get one question here. The question seems to want to explain if someone has always been having attacks, yeah, and then all of a sudden the attacks stop. Is that a miracle or is medically possible?
Okay, so it means if you've been having occurrences of attack taking place and then you take your medications, you go for your asthma clinics, you see your doctor frequently, of course, there will be a period in time where it looks like the asthma is laying dormant. But except for the fact that you stop doing all that you are supposed to be doing, there is a likelihood of it occurring at any point.
Which form do asthmatic attacks take? Like, I'm asking because I had a friend in secondary school who would just all of a sudden just, start to run helter-skelter, look for his
inhaler.
His inhaler. So describe the form in which it takes, so that if someone sees someone under attack, they can know and offer them help.
Okay, so the patient or the person starts coughing.
Okay.
Dry cough.
Okay.
Starts coughing. You realize that the patient finds it difficult to breathe. Yes, and then there's chest tightness. That's maybe the patients might hold on to their chest, trying to describe. They actually sit upright. You don't find them lying down because it's difficult for them to breathe. Sometimes in the severe cases, you see the person all confused, doesn't know what to do. And in children, you realize that when you try even feeding them, they refuse to take the food that you are giving them as well, and they look more agitated and confused. So that is like a typical presentation, and you could hear the reason as well. You could see
once
that
you
the
see
person
those signs,
anxious,
person is
sweaty, all that you can
coughing,
see. Coughing,
a dry cough.
Yes, a dry cough.
Okay. I also ask this because many people do not know what the signs are.
Oh yes.
I have my little brother's friend who traveled abroad for medical school. He passed away in, I think, Cuba, because the people around him did not understand
what was going on with him.
And it's really sad. And that's why I want you to educate the people so they know that if I see this, this is the kind of help I should give to the person, or this is what might be going on with the person. Let me take a quick question here for you to answer. I want to know much about adult onset asthma. Is that a thing?
Oh, yes.
Adult onset asthma, LABA and SABA, and how this helps in the management of remodeling the airways. I also want to know about the side effects of the LABA. I was diagnosed of asthma last week. This is a viewer here. So let's begin with what's adult onset asthma.
So adult onset asthma, simply put, is you being diagnosed with asthma in your adulthood.
Okay. So
so
you're older now.
Yeah.